This is Debbie Bucher for Parkland College, and today we will be going over Chapter 9 in the LPN to RN Transitions book by Laura Claywell, and it's Communicating with Patients and Coworkers. Verbal and nonverbal communication. Most communication between the sender and the receiver is nonverbal and must be interpreted correctly. Verbal and nonverbal communication must be congruent for a clear message to be presented and interpreted. Communication is seen as an interaction between two or more individuals with an exchange of information. An expression from one individual sender must be received by at least one other receiver. Verbal content is spoken communication, and nonverbal process is a tone, pitch, inflection. Therapeutic communication is when a nurse engages in a helping relationship with the patient and family. And the requirements of therapeutic communication is empathy, and it is the nurse's ability to perceive the patient's needs, feelings, and situation accurately, and it's not sympathy. Genuineness is ability to meet person to person in a therapeutic relationship. Positive regard implies respect and a willingness to work with the patient and communicate through actions that the patient is worthy of caring about. Self-awareness is recognition of one's own feelings, and non-judgmental is suspension or not judging others. A suspension of value judgments. We want to be careful. We don't want to judge somebody differently than what they may be trying to relay to us. Therapeutic communication requires empathy and an understanding of the patient's feelings of fear and helplessness. Hospitalizations are very stressful, and the nurse must, again, suspend value judgments and not take negative patient behavior personally, because many times these patients are in the hospital. Anybody that's in the hospital is experiencing probably some level of anxiety and worry over what it is that's going on, new diagnoses that they may be given, and new diagnoses that they may be given that may not have a favorable outcome. They may be tired. They have many responsibilities, and when they're in the hospital, they're not able to meet those responsibilities. So being in the hospital overall is just a very stressful event, and we just need to remember that and not take our patients seriously if they maybe are short with us or maybe not as kind to us as what we would like. It may not be, it probably has nothing to do with you, but all to do with what it is the patient is going through. So statements for good communication are, you can say, tell me more about, I heard you say, you sound angry, sad, hurt, anxious. Can you tell me about it? It must be hard for you to tell me how you are feeling. Sometimes when I feel sad, angry, anxious, hurt, I find myself, is that how you see it as well? So those are just some examples of therapeutic open communication that will allow your patient to feel, I think, a little more comfortable expressing how they're feeling and what's going on. And there are communication facilitators that do help with communication, and they enhance effective communication. The use of warmth, acceptance, friendliness, openness, empathy, and respect in all interactions is crucial. Providing for privacy, confidentiality, and comfort of the patient. Appropriate humor and touch can help foster a closer nurse-patient relationship, and always, always ask permission before touching the patient. These communication facilitators will help enhance effective communication. Active listening is also very important. You want to be attentive to the patient's verbal and nonverbal communication. Care must be taken to consider culturally appropriate nonverbal behaviors. We may inadvertently feel like maybe a patient is being disrespectful to us by not having eye contact with us, but when in reality in their culture they don't have eye contact with a female or with a nurse. So that's something you want to remember that you're taking into account, is maybe different cultures, because we see many different cultures that we're caring for. We want to make sure that we're respectful of their culture. Active listening establishes trust and requires an open mind and full concentration to hear what the patient is saying. It verifies and clarifies messages, and it uses open-ended questions versus closed-ended questions. Active listening is one of the most important skills of an RN. And again, patients need to feel that they are understood in order to feel connected to you as the nurse and to feel like that they know that you care. Poor eye contact or chewing gum or having distracting movements during a conversation can communicate a lack of interest on the RN's part. Instead, listen intently, nod your head, use empathy, and acknowledge what the patient is saying. Effective active listening requires a nurse to concentrate fully on what the patient is saying and to clarify the message with open-ended questions. Some communication blockers that tends to stop conversation and builds mistrust is using condescending language with your patients, questioning a patient's reasons rather than accepting them, why questions, task-oriented approach to nursing care where you're just interested in getting done the treatments and the medications and you're not really taking a personal interest in the patient, referring to a patient as a room or bed number, failing to listen attentively, offering unsolicited advice or false reassurances, using cliches, and engaging in gossip. Patients hesitate to communicate with nurses who are condescending and abrupt. Patients should be able to reveal personal information to the nurse without being judged. That's very important to remember. Don't just be a task-oriented nurse and don't just refer to the patient as a room number or a bed. Don't fail to listen attentively and be careful about offering unsolicited advice. And also, engaging in gossip with regards to the patient will also damage the nurse-patient relationship. The nurse-patient relationship it is a planned and goal-directed process that focuses on the patient's feelings, problems, and needs. It is not a social or intimate relationship. The orientation or an introductory phase begins with the initiation of the nurse-patient relationship, begins with development of a trusting relationship with the patient, includes introductions and goal setting, orients the patient to the facility, unit, room, and healthcare team. And the nurse-patient relationship is a therapeutic relationship that is goal-oriented. And again, there is the first phase or the orientation phase where you're establishing the trust with the patient. And it's important to make sure that you tell the patient and their family your name and know the patient's family names as well. Patient concerns need to be respected and plan questions that are sensitive to the patient's beliefs. Working phase is the second phase. It's the longest phase of the nursing relationship. It begins with the nursing assessment, interview, physical examination, and continues until the relationship is terminated. It's understanding the patient's story, using opening questions, positive interviewing techniques, inclusion of family and caregivers, and awareness of the patient's current condition, altering assessment, interview, and exam as needed. Interactions are deliberately planned, implemented, and evaluated in concert with the patient to reach mutually agreed on goals. Note questions that may have already been asked by others or other providers, so review the chart, particularly if it is a new admission, as others, including physicians, may have already asked and is documented. But if you do need to reassess whatever it is that's already been asked, then that's also important too. But you do want to make sure you're reviewing the information and maybe when you go in there to do the assessment that you validate some of that information. The RN needs to understand and engage in the patient's story and plan for enough time to understand the patient's story. This is the heart of nursing practice. Don't develop assumptions or have questions left unanswered, as it can lead to erroneous conclusions that could affect the patient's care. Do not interject your point of view or opinions, beliefs, or prejudices. Open, honest, and respectful dialogue with the patient and family is the standard of practice for the RN who wants and needs to provide safety and security of the patient while respecting the right to privacy of the patient. This is extremely important. And then there's the termination phase. It's the final phase of the nurse-patient relationship, and it's when that is completed. It needs sufficient planning, time to review goals and outcomes, as well as patient teaching, which is very important. And I would say patient teaching is a priority and probably one of the more time-consuming tasks I think that we take on with our patients, and we should. Patients need support because they may feel a safety net is being lost. Completion may result of discharge or transfer or due to the nurse's time off or change in jobs. One may feel anxious at the termination phase and allow the patient to express their fears and point out the progress the patient has made. And also talk up about if the patient's just maybe referring to or going to be taken care of by another nurse because you're going to. So question, a nurse is in the working phase of the patient and is using therapeutic communication techniques. Which response by the nurse will facilitate interactions? And if you said one, you're right. It must be hard to tell me how you are feeling. That's more of an open-ended question for the patient. It will get better tomorrow. You don't know if it's going to get better tomorrow. Why did you do that? That's condescending and making the patient feel like they did something wrong, and then that was wrong for you to do. That's not really what we want to convey to our patients either, because then that puts them in a defense mode. So health literacy is an individual's cognitive, social, motivational, and ability to gain access to, understand, and use information to promote and maintain health. Health literacy can be affected by education, culture, society, and the health system itself. Patients may have low health literacy skills with problems reading, comprehending, errors, and confusion. Strategies to help patients with low health literacy is to speak slowly, be specific and concrete rather than general, avoiding jargon and medical terminology, reinforcing information, use the teach-back technique, and easy to read or visual materials are also helpful. Among patients, there are levels of healthcare literacy which are affected by education, culture, and society. Patients with low literacy skills have the most trouble navigating the healthcare system because of the complicated rules, the medical jargon, and the lack of patient teaching. So clear communication and visual aids can help patients understand how to access and use health information. The World Health Organization defines health literacy as the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health. There's also a web source you may want to access, the Health Resources and Services Administration. Effective strategies, again, are making sure that you use avoiding jargon, the teach-back method, diagrams, videos. Maybe material needs to be in larger font so the patient can read it. And also the Joint Commission has a white paper which recommends 35 strategies to address health literacy, and it's called What Did the Doctor Say? Improving Health Literacy to Protect Patients' Safety. Very important. Health literacy and culture. Culture refers to beliefs, values, and learned patterns of behavior that guide thinking, actions, and decision-making. Cultural competence is the ability to provide care to diverse cultures competently, but first we must have a self-awareness of potential conflicting feelings, use of interpreters, and there may be nonverbal cues or different meanings for nonverbal behavior in each culture, which we need to be aware of. And there was a study in 2003 that 40 to 50% of people had literacy skills at or below the basic levels due to a language barrier. So the care you provide as an RN to those of different cultures may be affected by your lack of knowledge, prejudice, bias, and stereotyping. People of different cultures may have different views and meanings to their language that may differ greatly from English. You may also need to use an interpreter so that mistakes aren't made and misunderstandings don't take place, which is extremely important. Older adults may need special accommodations, again, like a larger font. Also for changes in hearing and vision, physical challenges, psychological factors such as depression, poor self-concept, mood, attitude, and the feeling of loss of control. Some strategies: you want to adjust pace of instructions and provide extra time, minimize distractions and repeat information, avoid use of abstract terms and negative messages, provide adequate light, avoid blue, green, or violet ink, it's harder to see, use a lower pitched voice, eliminate background noise, provide a paper and pencil, and have the patient restate the message. So again, older adults may present a challenge because of hearing and vision changes, so the nurse needs to consider how illness reduces the cognitive function and consequently adjust the clarity of communication. By 2030, 19% of the population will be 65 and older. This creates new challenges for nurses. Important to communicate well so the older adult has good understanding and is professional, ethical, and a legal responsibility of a nurse. Normal changes in cognition from aging are distractibility, reduced ability to process information. Taking many different medications can affect cognition as well. So it's important to have individual and purposeful education and teaching to help meet the elderly needs. Use a low-pitched voice for those who may be hard of hearing, and try to eliminate any background noise, and may need to use paper and pen to make sure that the patient is indeed understanding. Collaborative communication refers to interactions and functioning among patients and members of the healthcare team to provide safe, patient-centered quality care, and needs cultural competence in the workplace and among healthcare team members. And there are generational differences as well that we need to be aware of. There's the veterans, the baby boomers, Generation X, and millennials. So boomers are those born between 1946 and 1964. They view things with optimism and contribute in meaningful ways. Those born before 1960s and early 1980s are the Generation X, and these children are known as the latchkey children, as they have both parents working. They are loyal to their profession but not willing to compromise their family, personal, and professional well-being. They are creative and innovative. Millennials generation is 1980 to 2000. They were childcare, preschool, and after-school programs they experienced these. They were available and helped support families. These people tend to be open-minded, collaborate, and are civic-minded. So nursing has changed a lot in the last 16 years, and the generational diversity in the workplace can cause misunderstandings and conflicts. So it's important because we work with people of all ages and that we understand all the different ages and their different idiosyncrasies. Next is collaborative communication continued, and talking about passing information to healthcare team members, which is very important. You need to be concise with your reports, and you need to be detailed and making sure that you are passing on all the correct information. So the format that we use, or many hospitals use, is the SBAR format. So it's situation, background, assessment, and recommendation. It can be used in any type of handoff from an emergency patient situation, or on the floor situation, or really even in a clinic situation. So first you want to state the issue, which is the situation. Then you want to describe the background, what led up to the patient being in the hospital or coming to the clinic with a problem. State the problems, and that's your assessment part, and then make recommendations. So this communication can be difficult at times, but we need to make. I think the SBAR format really does kind of help get to the issues and keeping things succinct. And the original intent, the SBAR was developed by the U.S. Navy to help improve communication and has been further developed by Kaiser Permanente for use in the healthcare system. So that's where that came from. So again, the RN must have really strong communication skills in the healthcare setting, really no matter uh, where you're working at. You need to have strong communication skills, very important. And then here's a slide with the SBAR, excuse me. Okay, now delegation. It's important to delegate. You may be delegating in your current jobs as an LPN, maybe delegating to a healthcare tech or to a CNA. It's a transfer of authority to a competent individual to complete certain nursing tasks. The individual that you are delegating to must be qualified and must have demonstrated competency ability to carry out the task. So you certainly wouldn't delegate a PICC line or central line dressing change to the CNA. That is not within their scope of practice, of course. So you want to make sure that it is within their scope of practice. The task can be delegated if it is within the scope of practice of the person to whom it's assigned. RNs are not able to delegate certain functions that an RN does, such as RNs cannot delegate assessment, planning, evaluation, and nursing judgment. RNs retain accountability even if they do delegate. They still remain accountable. It doesn't matter if they're delegating or not. The RN is still the one accountable for that patient and for that task. So there's the five rights. There's the right task to be able to delegate. So right task, right circumstance, right person, right direction and communication, right supervision and evaluation, and also now right documentation. So again, the RN must delegate patient care to competent qualified staff members who are able to perform the task within their scope of practice. The RN must be assertive and clear while being fair but firm. The care manager is the RN and may need to delegate many aspects of the patient care to a variety of different individuals. The delegee is given the authority to complete a task that is outside the usual activities of the role of the delegee, and these people must be qualified and who has demonstrated competence to carry out the task. So you need to be careful who you're delegating to. So when you're delegating, you need to communicate clearly and concisely while considering cultural or ethical barriers. This requires sensitive but assertive communication, be fair but firm. And the more you are able to communicate your expectations effectively, the more your coworkers will come to trust you and rely on you for clear direction. So delegation by an RN is a key role of the RN and requires critical thinking. Delegation is differentiated from assignment in that the delegee is given the authority to complete a task that is outside the usual activities of the role of the delegate. Delegation must be made to another who is qualified via education, training, and competence, and has demonstrated competence ability to carry out the task. And continue with delegation. You must be able to think critically about the needs of each patient and whether or not, such as once you become an RN, if a licensed practical nurse would be able to perform the task competently and safely, you may very well may be delegating to LPNs depending on where you are working. And whether or not to delegate will depend on your assessment of the patient and your professional judgment. Okay. So collaborative communication is involved with the nurse-physician relationship as well. You need effective collaboration, and it creates effective teams and improves the work environment. Problems identified by nurses are inappropriate, disruptive, or abusive behavior, dismissive attitudes, and belittling or intimidating behavior by physicians. The Joint Commission has called for zero tolerance of abusive physicians. It was found that failure to communicate among healthcare professionals caused 70% of 2,455 reported sentinel events. So one of the most problematic collaborative relationships is the nurse-physician relationship, and it can greatly affect patient care. Differences in approach to healthcare can cause communication breakdown. Nurses can be empowered to be confident communicators by providing accurate clinical information, staying abreast of the most current advances in healthcare, and joining committees and professional organizations. I think that now I do believe that the physician and nurse relationship, I believe, is much better now than what it was when I started practicing many years ago. I do believe we were treated more like the physician, we were assistant to the physician, and going in, just doing little things for them, or getting coffee for them. We used to do that. So it's really changed. I see the relationship between a nurse and a physician much more collaborative now than what it used to be. Before, it was whatever that doctor said, that was what went, and many doctors would just not treat you very well at all. But that is one thing in nursing I do think has really improved a lot, which I'm very very glad that it has done that. So it makes the communication much easier between you and the care provider, be it the physician or maybe a physician assistant or NP. So again, teamwork is essential for optimal patient outcomes and safety. And the team steps, which again stands for team strategies and tools to enhance performance and patient safety. And it's an evidence-based toolkit developed by the Health Research and Educational Trust. And it composed of materials and educational programs intended to promote teamwork principles among healthcare professionals. Training is provided in the toolkit. Caregivers learn to better adapt to rapidly changing conditions, have a clear and common understanding of the care plans, and have a solid understanding of the benefits of teamwork in delivering safe, effective, and consistent patient care. So very important to work as certainly to work as a team. And the team steps can improve communication that takes place during crisis situations to ensure clear, coordinated action and reduce risk. When a crisis occurs, communication must be rapid and include all relevant information to improve decision making and good patient outcomes. So again, the chart is considered a legal document. To the right side here. So forms of documentation Orange use is transmit instructions, write plans of care, record interventions and outcomes, write nursing histories and nursing notes, which I think we already went over, but communicate assessment information, record and explain incidences, and pass on information, write memoranda, email, letters, and interdepartmental and institutional forms. And again, like I already alluded to, all forms of communication must be complete, succinct, relevant, accurate, and factual. Common errors in charting and communicating is using a medical diagnosis rather than acceptable nursing language to communicate a patient condition, using broad terms instead of specific signs and symptoms, creating or charting your own opinions, thoughts, and feelings. You really don't want to do that. Neglecting to record the patient's response to the intervention, which is very important, and using vague or ambiguous terms such as worse and better. You really need to be more objective. So common errors in charting are, yeah, again, these are common errors in documentation that you want to be mindful of and to stay away from doing. So some tips to reduce errors in charting are use the nursing process to guide the charting, consistently use standard language and approved abbreviations, or just don't even use abbreviations at all because I just don't think it's a good idea anymore. Record the patient's exact words verbatim as much as possible using quotes. That's good subjective information. Be truthful and stick to the facts. Chart patient response after treatments or medications or interventions. Use objective measures when possible. Use proper grammar and spelling and write legibly. Documentation must be factual, to the point, descriptive, relevant, accurate, clear, and precise. So yeah, so it's really important that we are very clear and factual in our communication. So also the information here is helping also to ensure clarity and accuracy, including these elements in your written communication. So you want to make sure that you're stating the purpose of the need, stating the problem or question at hand, stating information, data, observations, or experiences, stating conclusions or solutions, stating consequences or implications, and also stating perspective or frame of reference from which the reporting is being made. So written or electronic communication, including occurrence and incident reports, must include an attempt to explain through illustration and examples the importance of the incident to patient safety. An attempt should be made to remain neutral in the reporting, avoid giving opinions, expressing feelings, or labeling patients. Unsafe practice must be reported to direct supervision, facility management, and ultimately the Board of Nursing. Documentation and correspondence and officials regarding instances of unsafe practice must be accurate, truthful, and without personal opinion. So it's really important that you take the emotion and take that out of your charting and documentation, because it's only going to make it harder. And then collaborative communication, continuing as you want to document. Important to document is communication and document correspondence to officials regarding incidents of unsafe practice must be accurate, truthful, and without opinion, like I already said. So forms of documentation RNs will use is, plans of care, interventions, outcomes, nursing histories, nursing notes, communicating assessment information, recording and explaining incidences and passing on information, write email letters and interdepartmental forms. And again, no matter what kind of communication we're doing, it must be complete, succinct, relevant, accurate, and factual. And sound communication skills are the professional standard of practice for RNs. This now concludes